Today we are going to discuss a recently approved drug by the FDA, Lipfendra, that is generally used for the treatment of cholesterol. The category of this drug is PCSK9 inhibitors, generally lowered low density lipoprotein or the bad cholesterol. So let's discuss what is what is PCSK9. Today we are going to Lipfendra, that is recently approved by the FDA, and it generally considered as new era in cholesterol management. So before going further, just want to give you brief information about what is cholesterol. Generally, in our body, four type of cholesterol present in our body, in which only one considered as a good cholesterol, that is called high density lipoprotein. You can see this high density lipoprotein generally help in remove excess cholesterol from our blood streams. You can see these blue dots are high density lipoprotein, and the remaining cholesterol like low density lipoproteins as well as triglyceride as well as very low density lipoprotein considered as bad cholesterol and contribute for the formation of plaque that can lead to the life threatening disease like stroke as well as heart attacks. So you can see these are the LDL artery in left side, and you can see these LDL form plaque in our artery and narrowing the artery and obstruct the blood flow. These are the triglyceride and these are the VLDL, very low density lipoprotein. So apart from this HDL, remaining three cholesterol like LDL as well as VLDL as well as triglycerides produces very bad effect in our body, and that can generally result in life-threatening disease like heart attacks, different cardiovascular diseases as well as strokes. So now let's discuss something about how LDL effect in arteries. You can see on the screen there are two types of arteries. In the right sides, you can see the very bad effect of LDL in the artery. You can see this yellow part. This is plaque formation. As the LDL level elevated in the blood, it forms plaque in the arteries and narrowing these arteries. That can lead to the reduced flow of blood because it obstructs the flow of blood. You can see on the right side. In left side, these are the picture of healthier artery, wide open vessel, unrestricted blood flow for of healthy individuals. So these are the condition of healthy individual, and these are the condition of patient who are suffer from dyslipidemia or high cholesterol. So now, what are the current cholesterol treatment presently available? The first line drug still we considered as the first line therapy is statin therapy, because a lot of drugs like atorvastatin and rosuvastatin are available in the market either in solo form or in combination with some blood thinner like clopidogrel as well as ecosprin for the treatment of dyslipidemia or high cholesterol. Apart from these statins, there are one drug, ezetimibe, that generally reduce cholesterol absorption in the gut. And along with these two drugs, doctor always doctor always advises our dietary as well as exercise, some dietary changes as well as some adoption of some exercise like brisk walking of generally 25 to 30 minutes per day or at least 5 days in a week. And apart from these three, there are some treatment available, injectable PCSK9 inhibitor that are also highly effective drugs, but the main disadvantage of that drugs are that are available in the form of injection. So the patient who fear needle generally don't go for this treatment. But now FDA approved oral PCSK9 inhibitor. Let's go ahead. Lipfendra. These are the generally brand name of oral PCSK9 inhibitor, and the main content of this drug called Enlicitide. These are recently approved by the FDA. The dose of these drugs are once daily. The generic name, as I have already explained you, Enlicitide. So what is this PCSK9? PCSK9 is a protein. The full form of PCSK9 is proprotein convertase subtyrosin kexin type 9. This is full form of PCSK9. These are the actually protein produced by the liver, and these generally affect or control many LDL receptor present on the liver. So what happened when these PCSK9 elevated in the blood? These PCSK9 generally destroy LDL receptor, and as the LDL receptor destroyed, only fewer LDL receptor available, and this may result lower metabolism of low density lipoprotein. And consequently, as the metabolism of low density lipoprotein adversely affected by PCSK9, consequently LDL cholesterol rises at that very dangerous level, and that may result in various type of heart disease as well as strokes. Now the solution comes after FDA approved recently oral administered PCSK9 inhibitor Lipfendra. These Lipfendra generally block PCSK9 protein. So as the PCSK9 blocked by the Lipfendra drug, LDL receptor preserved more. That may result more LDL is cleared from the blood. But how this PCSK9 raises cholesterol? As I have already explained, that this protein made by liver destroy the LDL receptor, and as the receptor has been destroyed, only few receptor available, it adversely affect the metabolism of low density lipoprotein, and that's why low density lipoprotein level increases in the blood at the dangerous level. So how Lipfendra drug works? How it works? As I have already told you that it generally inhibit PCSK9 protein. It block PCSK9, and that may result receptor preserved, LDL receptor preserved, and these receptor then metabolize more LDL and clear from the blood, and thus consequently low level of LDL reduce in the blood. You can see there are phase 3 clinical trial result. In study 1, 56% of LDL removed has been observed. In study 2, 59% of LDL removed has been observed versus placebo. You can see the main key takeaway of this is that up to 59% of LDL reduction in phase 3 clinical trial versus placebo has already been observed. Now, who can benefit from the Lipfendra? If already statins is available, so why we go for the Lipfendra drugs? Actually, some patient, despite of taking statins, their LDL level remain persistently elevated. And for that type of patient, these drugs are very beneficial. So the patient who resistant from the statin can take benefit from Lipfendra. And another type of patient, those are genetically suffer from the dyslipidemic condition like familial hypercholesterolemia. Familial hypercholesterolemia can benefit from the Lipfendra. And apart from these two type of patient, the patient who fear from the needle can also take benefit from the Lipfendra because it is available in the oral form. You can see there is an oral comparison versus injectable PCSK9 inhibitor. Lipfendra available in the oral form, you have to take once daily. Injectable form, you have to take in every 2 to 4 weeks. But oral tablet can be easily swallowed with water. And in injectable, obviously injection required, needle required. And it is highly convenient as we can take at home. But in case of injectable PCSK9, we need to visit clinic. So the question arises, is that Lipfendra still better than statins? No, I have already explained you, it is not the substitute of statin. It can taken with statin. Lipfendra does not replace statin. Statin is still the gold standard treatment for the dyslipidemic patient. But it can be taken with the statin so that we can fill a critical gap, ideal for the statin intolerant patient and those who refuses injection. So if any patient who are statin intolerant or who fear from the injection can take Lipfendra, when their LDL levels are much more elevated. So at present, now after the approval of Lipfendra drug, there are statins as already considered as gold standard treatment for the hypolipidemic. Ezetimibe, these are the add-on for reduction of cholesterol absorption, and PCSK9 inhibitors like Lipfendra as well as lifestyle changes. So all these are collectively can produce beneficial effect for the dyslipidemic patient. So guys, all these are about the cholesterol in dyslipidemia. If you like my video, please comment me and please share as much as possible. You can also like my channel Code and Cure. I will definitely post more informative videos. Okay, bye bye.